more ligand types: inverse agonist and irreversible antagonist. Inverse agonist. To understand inverse agonist, we have to understand that some receptors have this basal activity. So what exactly does that mean? Let's say we have this heart cell. This heart cell, it has beta-1 receptors. It has this equilibrium between activity and inactivity, which results in spontaneous downstream effects. So we have this state of equilibrium. All the receptors around the heart cell are spontaneously firing to keep this basal level activity. It has a steady state. See, it's a non-zero number. It has some sort of basal activity on the heart cell. Inverse agonist will bind to beta-1 receptors and inhibit basal activity. If we have no more basal activity because the beta-1 receptors are bound to an inverse agonist, then there is no maintenance of cardiac output. This is why inverse agonists can be dangerous. In the example of the heart cell that we're using this inverse agonist on, patients who rely on the basal activity of beta-1 cells, some sort of medical history like heart failure, loss of basal activity can be life-threatening, especially in patients who depend on that signaling to maintain homeostasis. A good example of an inverse agonist that blocks beta-1 receptor basal activity is propranolol. So when propranolol binds, we won't get any basal activity, it will go straight down to zero. Inverse agonist versus antagonist. Inverse agonists sit on the receptor binding site and inhibit the receptor's basal activity. They sit in the same binding site that agonists sit in, so they compete. Side note, if we were to graph where the y-axis is percent of the receptor response and the x-axis is dose of full agonist given, the line would start in a non-zero number. Why? Because a receptor has its natural basal activity. As the full agonist begins to saturate the receptors, we would see that the receptor activity would then go to 100%. Full agonist has an intrinsic activity of 1, so we would see 100%. Say we were using an inverse agonist, we would still start at a non-zero number since the receptor has basal activity. But as we start increasing the dose of inverse agonist, we'll see that it'll go to 0 because inverse agonists block basal activity. Antagonist. They sit at the receptor binding site but don't block receptor activity. They do not block receptor activity. So when an antagonist binds, in our graph that we created with receptor response on y-axis, dose on the x-axis, you'll see that there isn't a increase nor decrease of basal activity. Basal activity is preserved. Irreversible antagonist. When irreversible antagonists bind, it binds covalently, and the receptor is blocked for the rest of its life. Plavix is the irreversible antagonist. Plavix covalently binds to receptors on platelets and inhibits clotting due to blocking all other ligands from binding to the platelet receptors. Platelets don't have nucleus to synthesize new proteins, so new receptors won't come out for the rest of that platelet's life. This means that when Plavix binds to the platelet receptors, that platelet is inhibited for the rest of its lifetime. A platelet lives about 7 to 10 days in circulation. Normal platelet function returns once new platelets are produced by the body. This is using Plavix as an example.